That's going to show my age, but nevertheless, I've been a GP for about 25 years. I qualified in Sri Lanka and Pakistan. I did part of my training in both those countries and then came over to Australia in 1997. And I've worked at Monash Medical Center for 5 years and then went into general practice in country Victoria, and I've been there since. Loved it, but came down here for a sea change. Yeah, it intrigued me, especially after speaking with Michelle. I was fascinated by it, and now the current study I am doing with the Nutritional and Environmental Medicine College is, it's blowing my mind about how much is out there that is, maneuverable and can help people with change. Conventional medicine, which I've practiced up till now, have basically, I guess, had one focus, whereas now I am thinking about things a bit more broadly and incorporating lots of lifestyle and other factors into the mix, and why a person would be ill as opposed to just attacking the disease alone. Looking at the person as a whole and not the disease alone. And looking more deeper into their lifestyle, their diets, their, those types of things, and maneuvering those things in the right manner, I have found have helped a lot of my patients. I have come from a big practice. I find this practice is like a family, well supported. The community, I feel, respects and acknowledges the work that is done here, which is quite satisfying to know. And the patients that come here, most of them have been to conventional GPs, and they come here to get that extra bit of help. And when you can and do give it, it's quite fulfilling. Sugar, can I say? No, I'm kidding. If just picking one would be zinc, just because of the fact that, during conventional medicine practices, we hardly ever checked it or, knew the consequences of it or what its functions were. But now, since I've started here, I realize that, there are like hundreds of enzymes that depend on function because of zinc. The immune system needs zinc. Wound healing, upper respiratory infections, things that are quite common, get help from zinc. So I'd say that. My health motto would be that change is not the difficult thing to do. It's the resistance to change that is difficult.